She's our
That's $100 million mistake.
Yes. She's a friend of mine.
Oh, we're gonna get
Can you hold on 1 second?
gavel in real quick. We don't need to do a roll call, do we? You've got the, all right, so we've got 4, and now I've got Sarah Devin's proxy. Welcome everyone to Health Professions. We just gaveled in, we've got quorum. Sarah Donovan will be back in a minute. I have her proxy so we're ready to get started, but we have no patrons. Sarah Barker, do you want to have member bills at the very beginning?
Sure, why not?
All right, so Senate Bill 829. You like to tell us about your bill?
Substitute on that one?
Is there a motion on the substitute?
Yes, let's see.
I'll move the substitute.
I'll second that.
Any in favor of that motion will signify by voting aye.
Aye.
Any opposed to that? All right, the substitute's before us. Can you tell us first what's a little different about the substitute? Council, would you like to report some of the differences in the substitute from what those of us have looked at previously?
Maybe refresh my memory.
Mr. Chairman, thank you. The original bill, as well as substitute, deals with the military medical personnel pilot, which in the bill is no longer a pilot, but under the substitute, those who qualify can practice under the supervision of a registered nurse and can do functions within the scope of practice of nursing.
This is an initiative that we had beginning a couple of years ago with a pilot program related to people coming out of the military who had certain medical experience there, but didn't qualify in their licensure provisions in Virginia for their comparable positions to get them into a situation where they are working in many instances full-time or at least part-time in medical settings under certain supervision to be able to do the type of things that they're trained to do and they've been doing when they were in the military. And at the same time, many of them then go on and take the classes and the other types of things to be able to get their license in whatever, especially if they're working in there. And what this does is expands it a little bit in terms of the supervision options that are there so that they can really practice well in a wide variety of settings.
Thank you, Senator Barker. Does anyone have any, from the subcommittee, have any questions for Senator Barker? Is there anyone that has concerns with the bill from the audience? All right, is there anyone that would just like to register support for the bill?
Yes, sir. Good morning, members of the committee. Karen Allport, Director of Policy and Planning, Department of Veteran Services. This is an agency bill. Thanks, Senator Barker, for carrying it. We asked for the substitute on the House side, and this is just to conform to the House version that's right there. We'll come over next week. In working with our partner healthcare systems in the first year of the pilot, we discovered in some of their hospital systems they need a little bit more flexibility with supervision, and so this helps them and will help us get even more medicine coming into Virginia hospitals working for healthcare systems.
All right, thank you. Senator Barker probably wants to second that. Any discussion on the motion to recommend report by the full committee? All right, as many as favor that motion will signify by voting aye. Aye. Opposed? And that will come out on a 5-0 vote to recommend report. And I don't see.
I have an easy one for you.
Oh yeah. So we'll do Senate Bill 832, Senator Carey.
If I could do 505 first, that way, I got a recommendation.
Sure.
Senate Bill 505 is dealing with the Doctorate of Medical Science licensure. We heard this bill at length last year. It's back again this year. This is a program that is right now being set up through the LMU, which is a college in Tennessee across the border from Virginia, to make a pathway for physician assistants to be able to get their degree and become a doctor. And Tennessee right now is going through the process with the same type of legislation in Tennessee to do the same thing to try to address the shortages in the Appalachia region of Virginia. Because Tennessee is still working and trying to figure out what they're going to name this position, we've decided that the best option that we have right now is to carry this bill over till 2019 and to see how the agency addresses the naming of what these doctors will be. And there was some issues that we're going to try to work out through the Attorney General's office with prescribing in the bill what these doctors will be able to practice in and so forth. So if it's the will of the committee to recommend that we carry it over until 2019, that would be feasible because we still have some work to do. So,
Second.
Thank you. So the motion before us is to continue Senate Bill 505 to 2019. Is there anyone that feels compelled to speak on this? All right, the motion's before us. Many in favor of that motion will signify by voting aye. Aye. Many oppose that, and that would be continued to 2019. Senator Carrick, would you like to do 832 now?
I can do that. Yeah.
Senator Newman. I certainly think that's okay. I think the subcommittee find that agreeable.
Yes.
All right. So, as I watch people come in and out of the room, what we have is Senate Bill 370 brought forward by Senator Newman. First, I'd like to make a motion just so I can make that clear. Can I get a motion that to advance to full committee without recommendation?
Yes, Mr. Chair, we have to make the motion that we hear testimony today on the bill and then refer to committee without recommendation at this point.
We've got the motion before us. Any discussion? Many in favor of that motion will please signify by voting aye.
Aye.
All right. And that's going to come out now with a 6-0 recommendation of no recommendation. So to be clear to everyone, every other bill that you hear today, we're probably going to make a recommendation one way or the other is the plan. We just voted that on Senate Bill 370, we've advanced it to full committee, but we do not plan to make a recommendation one way or the other. We'll vote in full committee on Thursday. But if there's anyone that feels compelled to speak, offer testimony today, especially if you're folks that traveled, that aren't regularly here in Richmond, we appreciate you speaking today. Well, I recognize you, so, but
I'm going to introduce.
yes, certainly.
May I introduce, thank you for your time. Members of the committee, representing the Pharmaceutical Care Management Association, and we do have some shipments by mail. So I'll let, I don't know how you wanna do this, if you wanna present or have him answer questions first.
So what we'll do is, folks can come give their testimony on what the essentials of what they think we need to know. Remember, we won't be voting today, so your goal is to get us something that we will remember between now and Thursday. So give us your best arguments and your greatest concerns. And if anyone has any questions in the subcommittee, member will have the opportunity to ask you. So would you like to go now, sir?
Great, thank you, Mr. Chairman. Thank you, Senator Newman, for the opportunity. I appreciate it. Like Karen said, my name is Scott Woods, and I represent the Pharmaceutical Care Management Association. It's our trade association that represents pharmacy benefit managers, or PBMs, many of which operate mail order and specialty pharmacies around the country, which ship prescription drugs in the Commonwealth as well. We have a couple of concerns with the Senate Bill 370. First, we think that given existing Food and Drug Administration regulations which govern the handling, shipment, storage of drugs across the United States, those regulations pertain to wholesalers, manufacturers, pharmacies, both the brick and mortar as well as mail order and specialty pharmacies. And those regulations that are in place, we think are frankly working as well as they should. Guidelines by the U.S. Pharmacopeia, which develops guidelines for how medications should be stored, among other things. They don't have a requirement for temperature monitoring devices. And if either U.S. Pharmacopeia or the FDA had thought that this was a serious enough issue that would necessitate a nationwide regulation, they would have already done so. Second, if you kind of follow the argument logically that this is necessary at one point in the drug supply chain, then you would need to have these temperature monitoring devices in all shipments from the manufacturer to the wholesaler, and the wholesaler to pharmacies, whether it's the brick and mortar Walgreens or CVS, or pharmacy or the mail order pharmacy. So if we're going to require it for one part of the supply chain, we need to require it for the whole supply chain. But of course, that would incur a lot of costs. And we think, frankly, the company that is advocating for these types of devices, it's if you were able to put in place a mandate that this is included in all drug shipments in the Commonwealth, that's not only going to create sort of captive audience, but then that would then provide a license basically to be able to raise the cost of the product. And mail order and specialty pharmacy is increasingly seen as a low-cost and efficient drug channel for delivery of medications.
Does anyone have any questions for the speaker? Sir, you're certainly invited to ask any questions you'd like to.
Sir, I think the gentleman has a lot of points. I'm a truth seeker in this, right? I mean, I'm not an advocate. The concern that I think we have, or I've had a bit, is that you have indications of efficacy at a change of temperature, and the ones that have an efficacy change of temperature, and they're sometimes shipped by UPS and airlines, and maybe in the the temperature can change a bit. I just want to make sure that we find a way to make sure we know the efficacy. In other words, if there's a lack of efficacy, you may not know that as much. So what I've requested, Mr. Chairman, is that we continue to talk about that, understand what the Orange Book requires, and what it says, and then how the federal regulation go. As you know, the Board of Pharmacy looked at this, and we can agree and disagree with the board occasionally, but it was a very close vote. It was a 4-5 vote. Some concerns, some thinking things are okay. But, Mr. Chairman, I think the gentleman has raised a number of other reasonable concerns, and if you would allow it to go by for today, I think that we can continue to look at it and see if there's a way to move forward.
Well, thank you for
Great, thank
giving
you.
us a lot to think about between now and Thursday. And also, if you want to reiterate anything, you can email us. And, well, I'm sure we're going to think about this a lot between now and Thursday.
Thank you, appreciate it.
Is there anyone else that has traveled that has something they'd like to tell us? Because I think we're going to discuss this again on Thursday. recognize you too.
Michelle Satterman on behalf of Temp Time, and I'm not speaking for Temp Time. We had, just to let you know, we had told the patients who were coming that we would be having this meeting on Thursday, so we asked them not to come. One actually did come, she's downstairs, but I think she can make it up here in time. I know her testimony, I can share those comments with you.
Well, if you have other patients that plan to be here on Thursday, I think that we'll probably be hearing about this on Thursday.
Okay.
All right,
Thank
so does that complete everyone in the room who feels compelled to speak on it today that might not be able to come Thursday? Thank you, sir, for your testimony. And we've already voted that it's been advanced to full committee without recommendation. And we will discuss this a lot more on Thursday. That completes. Track and trace. Nice. All right.
Senator Vogel has asked for that back of eye for the year.
All right, thank you. And just so everyone knows, this gentleman is employed by Senator Vogel, so it's not just someone that walked in the room to kill her bill or delay her bill at least. Is there a motion?
So moved. That's fine for the year.
All right, Senate Bill 973, the motion is to continue to 2019. Is there any discussion? Anyone feel compelled to speak? Ms. May is favor of the motion will vote aye.
Aye.
Ms. May is oppose it. And on a 6-0 vote, it's continued to 2019. It's the recommendation for the full committee. Senator Evan.
Thank you. This is Senate Bill 918. And I would like to explain the bill, but there is two options for the committee. One is just to adopt the bill as it's written, and then I have a bill that is very similar that passed the House 98-0, and I'm not fond of conference committees myself, so I wanted to explain that one as well. But in terms of this bill, it has to do with repealing professional licensure in the Department of Healthcare Professionals, or revoking licenses for healthcare professionals who are behind in their student loans when they're delinquent or in default. And we had in the 1990s, I think it was 1990 to be exact, the Department of Education federally had urged states to go ahead and take away professional licenses. Now the trend is the opposite way now. At least 3 states in the last few years have engaged in bipartisan efforts to no longer do this. South Dakota was suspending people's driver's licenses, but in some states they were suspending licenses of firefighters, nurses, teachers, lawyers, massage therapists, barbers, psychologists, and real estate brokers had had their credentials suspended or revoked. The bill that's before you, 918, deals specifically with healthcare professionals. And the reason that we're dealing with nurses, nurse practitioners, surgical assistants, athletic trainers, etc., is that that's the one that's on the books right now in Virginia. The bill from the other body talked about how you couldn't do it for others. And when I checked into this, although it's only explicit for Department of Health professionals, that there's something, and I wish I could call term, I think it's called in good standing, where most professions you're supposed to be in good standing, and no one's ever tried to revoke on that basis. But this would be preemptive on the both.
One second.
I have what he's talking about. I don't know what the committee.
I was going to see what the will of the committee was on the first.
I would recommend you go with the one that passed the House 98-0.
Okay, that's the one that's being handed
I
now.
would move that we adopt that on the substance.
We're going to consider that motion in a second. Council, looking at the substitute, just making sure that it's still something that would be, general laws isn't going to meet again, but a lot of these other professions are usually dealt with in general laws.
That's correct, sir, but the bill would still deal with teachers in 22-1 and then all the health professions. So I still think it would be.
And student loans.
Scope of the committee.
Okay, so we've got the motion to adopt the amendment in the nature of substitute. As many as favor that motion? As many as oppose that? All right. That substitutes before us. I think this is something that our chairman can, we can probably pass it out like council said, but something our chairman should probably talk about with the chairman of general laws. Is there anyone that has any questions for Senator Evan? Is there anyone in the audience that has concerns about the bill? Is there anyone in the audience that feels compelled to speak and register support for the bill?
Mr. Chairman, Scott Johnson for the Medical Society. We support this on behalf of our residents and encourage you to advance the bill.
Thank you, sir.
Mr. Chairman, Andrew Lamar, on behalf of the Virginia Nurses Association, we support the bill.
Thank you.
Second.
All right, we've got a motion before us to recommend report of the substitute. Is there any discussion? As many as favor the motion will signify by voting aye. Aye. Opposed, no. All right, that recommends for report in the substitute, all right, 6-0 vote.
Should I will come to the full committee, that's Thursday at what time?
8 we start.
Okay, just in case there's any questions.
I'm not certain you need to come to the full committee.
I don't want you
But I would check in with Senator Ruff and Senator Newman both, just to make sure they're aware. Yeah,
Okay.
we'll present it.
Okay, thank you very much, members of the committee.
Senator Carrico, 8:05.
Or 8:30, I'm sorry. Mr. Chairman, the bill before you is dealing with, this came from the administration, dealing with Schedule 5 drugs and naloxone reporting under PMP. I've had a couple of bills to try to address some of the abuse and some of the things that are going on with written prescriptions for naloxone and for Schedule 5. And this one would include it in the prescription monitoring program. It includes Schedule 5 drugs, which a prescription has been issued, and naloxone, and it's based on premises of capturing information about the patient's prescription history and to know whether the patient who's at risk for a drug overdose already has a prescription for naloxone. And it gives us the ability to have a complete picture of the controlled substance that a patient's receiving. When we talk about opioid addictions and so forth, and part of that war against prescription drug abuse and overdoses, it's important that we're able to manage the chronic pains with opioid and to know whether the patient's filled a prescription for naloxone or not. Some of the combinations of Schedule 5 drugs may be dangerous if it's prescribed with opioids, and that's the reason that the Schedule 5 inclusion is there. And it was some of the Schedule 5 drugs that are dispensed without prescription by having a patient sign a logbook to avoid overdue burdens and expenses for pharmacies. Like I said, this came from the administration. This came on a result, and I think we've already heard one that dealt with law enforcement and first responders reporting to the Office of Medical Examiners to report overdose deaths and so forth and overdoses for the opioid issue, and this is just in combination with that. And I know Dr. Brown's here, so he can speak further to it. And you know, we have a huge problem going on in Virginia and all across the United States with opioids. This this is just one of those ways that we hope that we can track and understand what people are actually utilizing these drugs for once they're prescribed.
I'm sorry. Thank you, Senator Carrico. Does anyone on the subcommittee have any questions for the patron? Is there anyone in the audience that has any concerns about the bill? Seems like a pretty straightforward bill that I think is going to pass out. Is there anyone that just feels compelled to register support?
David Brown, Director of the Department of Health Professions, and it is our bill, and I'd like to make sure the administration supports it.
Thank you, sir. Appreciate how long that was. All right. We've got the motion before us is to recommend report of Senate Bill 832. As many as favor that motion, signify by voting aye.
Aye.
And oppose it. That comes out on a 6-0 vote recommending report.
Do I need to be at the full committee?
No, sir. You can step out and talk to wherever you want to go instead. And so we now have Senate Bill 812 by Senator Barker.
Right. This is my other bill I have up this morning here. This is a bill brought by requested by the Department of Corrections. It deals with qualified mental health professionals. Last year we passed legislation to put a definition of qualified mental health professionals and peer recovery specialists, which I think is already having some very positive impacts on things. But in terms of who could qualify as a qualified mental health professional, there were individuals who work with the Department of Corrections and provide mental health services to people within the correctional system who were not eligible to be able to be categorized here as that. So all this would do was on line 43, and the Department of Corrections is one of the entities that can be involved in designated people as qualified mental health professionals.
Thank you, Senator Barker. Are there any questions for members of the subcommittee for the patron?
Who's requested this? I'm sorry.
This is the Department of Corrections requested this, and there are individuals here to be able to speak to it if you'd like. So,
is there anyone that has any concerns about this bill? All right, I think this one's also on a pretty good track. Is there anyone that wants to register support for it, though?
Of course, Ray Vargo, Department of Corrections. This is one of our agency bills, and this will correct a problem and allow our qualified mental health professionals, of which we have about 140 throughout all of our prisons in Virginia, not just at our 6 licensed sites, to be able to continue operating as qualified mental health professionals.
Thank you. All right, is there a motion? We've got a motion to recommend report. Any discussion on that motion?
I just have one question.
Senator Lucas.
Because as I looked at the definition for QHMRP, they usually have educational credentials that are required, so how do you get around that?
So wait 1 second. Senator Barker, would you like to have them answer that?
sure.
Good morning to the committee. I'm Dr. Denise Moen. I'm the Chief of Mental Health Services. I'm a licensed clinical psychologist and a board-certified behavior analyst. And our folks truly are qualified mental health professionals. We verify their credentials, their training, their education before we hire them. Not only that, but we also provide clinical supervision, and we require CEUs every year after that.
Thank you.
You're welcome.
That answers the question.
Thank you. Senator Lucas, thank you for your help. All right, we've got the motion before us. Is there any more discussion? As many as favor the motion to recommend report, signify by voting aye.
Aye.
Opposed? And I think the proxies for, so that's a 6-0 vote to recommend report as well. And I believe that completes our docket today. And so anyone that has, strongly supports Senate Bill 370 or has concerns about Senate Bill 370, you all should send emails and make your visits and anticipate we're going to have another discussion about that on Thursday. So thank you everyone for coming.
have a little.
How are you? Spreading goodwill and Christmas cheer.
Thank you. Much appreciated.
Sorry we missed it last year, but.
Well, yes, the Director of Mental Health Services, she has been pushing to make sure that this is happening, so we couldn't do it without her being here today.
And we couldn't do it without her being here, so.
Yeah.
It's important for us. I'll be here on Thursday.
Yeah. Next week is crossover, so all the Senate bills have to be heard. It's all out. Put in the House by next Tuesday. If they're not, they're.
Maybe I'll get one.
And the Senate bills are in the House. The Senate committee is always Thursday, and then the House committee is Tuesday. For the subcommittee, anytime. So we'll know probably 24 to 48 hours when our bills will be on the docket. And it's sometimes the one that is, I mean, it changes too, but it's usually at the beginning of session, we know like this session. Yeah. Well, we'll see what happens next year. Thank you. Because they get it. They're built up at 90 days.
But I would rather.
The chair. Yeah, we're gonna have to sit down. We gotta find two. We gotta sit down with one. Just like you would. Those have so we need to make sure that those are a first. I need to jointly send a letter in response to say, outline what that is, and then look at the laws.
Oh, no, I'm fine.
Yeah. Yeah, oh, yeah. Hey, we're talking about, well, no, I can't talk about this, I'm going to get this out. I know you can't.
You had another meeting downstairs, like.
Once we get them marked, then we'll have a conversation. Just let it I'm lucky my wife is the same.
As am I, but I
Okay, thank you.
Yeah, you're gonna practice.
Actually, but you don't have in order for
the only thing we do is the.
Oh,
the same level, yeah.
correct.
Yeah, that's,
You still have to do physical therapy for that.
I know.
For what?
They still have them. So I don't get in my next class.
Is that perfect?
Gosh, well then.
Well, you know.
For some reason, always, I can't keep broken bones, I don't know what it is. That sounds awful.
I'm walking, so, and like, it's been, 5 years and I'm back. I've lost,
Oh, I am moving, I'm getting out of here.
no, I don't see you.
Just sit here in the
No,
dark.
no, I don't see you.
What's that?
I can't see you.
Oh, can you see me now?
If I see you, I can bring you out.
Uh-oh.
No, no, that's okay, go ahead.
Oh, no, I was literally just sort of sitting
But
here.
I almost missed you.
That would have been funny. Well, you got my attention when the lights went up.
Well, cause you were, see, right now, you cannot see you from the door.
That's all.
Well, I see somebody left papers. After every meeting, we get a call. I left my keys, or I left my computer, I see a cup up here.
Yeah, I know.
So
I don't know.
I was just kind of looking.
Yeah, I'm
Look at this
usually pretty
camera
good
there.
about trying to, keep my stuff on me.
Well, that's good.